Hello, everyone. Nice to meet you all. I'm Nesrine Benyahia, the CEO and the founder of Dr. Data. So I will talk to you about trust in AI, how we can build this trust from the beginning when we will process the data, and how we will do this with the patient, because at the end of the day, we need to inform the patient, and we are doing everything we are doing to help the patient for a better care. So I have a small video to watch. I hope this is working. This is not the real font of the company. There is a mistake. Can you just pass to another slide, please? The next one. Thank you. Can you play the video, please? So this is not a Black Mirror's episode. But to give you insight, can you just move to this next slide, please? This is not working. Thank you. What I want to tell you today is like we are really at the beginning of something really huge. We see OpenAI, we see ChatGPT, etc. You will see today all the AI application we can find in health. But mostly, I think some of you, maybe most of you, know that we need data to do so. And we need real-world data to do this kind of research, to create the models and the algorithm, and then these applications at the end. So even if we will go to synthetic data, maybe you heard about synthetic data. So synthetic data, at first, is created from real data. And how can you trust something synthetic if the real-world data is not really accurate? You have no integrity about quality, no compliance, because you don't know from who is coming this kind of data. This is really something important. And even if we can use the synthetic data to create drugs, because the authorities, we need proof to do so, at the end of the process, you need to go back to the patient with the real data and do the clinical validation with it. This is really something really important, because really based on trust. And our experience at Dr. Data, privacy is our job. I think you you understand this. We are data protection officers, and we really saw a lot of issues about how informing a lot of patients that you don't see from like 2, 4, or 5 years in the hospital or in your app, or a remote monitoring app, for instance. How you can go back to the patient, ask something to the patient. We are not used to do that. You're not used to ask to patients, okay, I will need something from you, the data, something really sensitive. It's not, only the email address. It's the medical files. And there is this kind of feeling of each patient, maybe for you also, that the medical data is our property as patients. It's something really sensitive. And it's not the case, at least in France and Europe. We are not, we don't own our own sensitive data, our own medical data. So this is really something important to explain to the patient. And what we are trying to build in Dr. Data is something to have this kind of bridge between the research world, the data world, and the real world, which is the patient who doesn't know that he will need the data to create an algorithm in medical imaging, and maybe makes a lot of money also. So that's why we create this e-consent solution. So it's more like just saying yes or no. It's really about education and pedagogy, because transparency alone is nothing. We need to educate people at first, maybe you, the professional, the patient, because what we are used to say to our clients, it's behind each line of your data set, behind each medical imaging, there is a life. There is an intimacy. Maybe a partner of yours doesn't want to tell you something about his health. So let's imagine this kind of medical data is outside in the world to someone. So what we built is that some of you were last year here in this present pitch or not? No? I did really something, it's an exercise. Can you just take off your phone, please? Can we do this clinical trial together? Okay, so open the last message you sent or you received. Slack, iMessage, WhatsApp, whatever. The last email even. Okay? So, no, give your phone to the neighbor. Give your phone to the neighbor. If it's an Amazon delivery, it doesn't count. So, this is something, you don't know your neighbor. I'm asking to you to give your phone with a sensitive, maybe personal information, and imagine telling that to patients. Yeah, a large number of patients. So that's what we're trying to build with this our consent solution. So we, for Dr. Data is existing from like 2018. And in 2020, we saw that there is a lot of issue to inform a large number of patients for data study and create as data warehouses. And we really did this kind of solution, which is a SaaS solution. Just to give you quick KPIs, the last month, we informed like 500,000 patients in a few days on data studies. So there is something about also the traceability, because as you saw, we use smart contract to do so. So as I used to say, the internet creates the data, and I think the Web3 technologies will give value to this data about quality, integrity, and traceability, and of course, trust. We also have another use case in clinical trials. The clinical trials is really something more complicated, because we really need to have the opt-in of the patient. We need to have the sharing information with the physician and the patient, which is something really complicated to do when it's decentralized. So we need really to have this kind of traceability, integrity really built in the solution, and something really user-friendly also. And for the medical procedure also. So this is something I want you to just to understand a bit, because we are talking to patients each day using the solution, because each patient through his consent store can ask us questions. And they were like, how is the opt-out working? Because this is my data. I have to give you my consent. And you are telling me I will inform you. And if I just say nothing in 30 days, you can use the data. What's it? What's this? It's not something really in the citizen really understand very well. So that's what we did with the one-stop shop for e-consent based on smart contract. We work a lot with the authorities to explain how this is working with the industry also, and we'll start up a scale-up to go fast on collecting the data and do it in a proper way. So just to give you a few figures, because I have like 5 seconds left, we have like more 40 organizations using the solution, and now we have like 2 million e-consents on contracts to manage since the beginning of the year. Mostly for real-world evidence data, so data study, health data warehouses, which is a large volume of patients. So we have a lot of challenges about the scalability on the solution, but also on the blockchain. So if you know a little bit about the distributed ledger, it's something really complicated to use also. And we have like the 2 patents because I'm a lawyer and I have to do this. So some KPIs, we have like less than 3% of opt-out because we are doing this kind of information to the patient. We are really answering to the support to the patient to really explain how the institution, the organization needs the data to go through the advanced research. And mostly, I think the most important KPI is like, since we are able to manage a large volume of patients to inform, all our clients just have a lot of patients to enroll now. There is no limit to the technology. There is no limit to the number of projects because there is less administrative burden on the research project manager and the facility also. This is really something important because it's not always about the compliance, it's also about how we can use the technology to break the regulation, to access more data, and do it in an ethical way. I think this is the same time thing we have with our French president. And that's the end of my presentation. And as my head of operation told me last week, let's make e-consent great again. Thank you, everyone.